Thank you, Alex. Good afternoon, everyone in New Mexico. Lots in the news this week, so we'll try to hit the high points. Just want to thank Julia Goldberg, Algernon Diamasa, Leslie Engel for your advanced questions. We've converted the answers to some of those questions into slides, so you might want to be thinking about another question as we go on here. So next slide, please, Brianna. This is everything you know and need to know about epidemiology in one slide. Our epi curve of cases at the top, the big tall spike, twice as big as the one in November, December, 2 years ago now, 2 calendar years ago, sorry. And following that in the middle, the hospitalization rates, which almost got us high. This is the number of people in the hospital, rolling 7-day average. The 370 over the last 7 days is not the number of people in the hospital. That's still running in the high 500s, low 600s. It's the number of people admitted to the hospital. And about 5% of all COVID cases since the beginning of the pandemic have been actually admitted to the hospital. And almost a quarter, if things keep up, or even with them dying down in the next 2 weeks, 25% of individual New Mexicans will have had a test positive coronavirus infection with COVID-19, one of its variants. Lastly, the death rate, 78 in the last 14 days. We do run about a 6-week lag. So if you look in the lower right-hand corner of the 3 graphs there, deaths dropping off, that really, we should put a gray bar over that, because really, I think that's going to fill in as we get death certificates in. The wintertime is a slower time of year to get these processed. And so we'll be informing you about our hearts do go. We have 6,555 New Mexicans who've succumbed to COVID-19. Then you think of all the family members and friends that knew them. Very few of us have not had our lives affected by this disease. I have a very good friend who's a physician leader actually here in New Mexico, who's working really hard to keep his hospital open and serving all the patients that are swarming to the emergency room and to the inpatient wards and the ICUs. And he, of course, is fully vaccinated and boosted. His brother was not vaccinated. His brother contracted COVID a couple of weeks ago and passed from COVID. And again, almost all of our deaths these days from COVID are in unvaccinated or particularly in unboosted individuals. And we are getting to the point where COVID could be, for the vast majority of people, a preventable illness. And so our hearts go out to those families who've lost people. My heart goes out to my friend who lost his brother. And we want to keep doing everything we can do to bring the right treatments and preventative measures to our state to ensure that kids and adults and older adults all stay safe. Next slide, please, Brianna. Vaccine update, almost everything in one slide, 77.5% with the primary series completed. Interestingly, 91.4% of New Mexicans have had one shot, so they've tried it. Julie, you asked what the age breakdown is, and the 42.8% of all New Mexicans 18 plus have had a booster. 15.3% of all New Mexicans 12 to 17 have had one. Some of that's timing, because but actually we're now at the point in time where almost all those folks are eligible for the booster. So we're working hard to try to promote or boost, if you will, booster shots in young adults. Also in the news, Moderna is now fully approved by the FDA. Its primary series of 2 vaccines, similar to Pfizer last fall. They are no longer under EUA status, and we have pretty solid word from the federal government that the COVID-19 vaccine will be available soon for kids under 5 years old. Pfizer submitted the data for children 6 months to 4 years old for EUA status. That will be reviewed by the various federal committees, looked at by folks here in New Mexico and our medical advisory team. And actually, I wanted to put a special pitch out because unlike vaccines for adults, where the majority of them are administered in pharmacies, for kids, and particularly young kids, the majority of vaccines are actually given in pediatricians and family doctors' offices. And so we have a plan to roll out the vaccine for the whole state. It's all finished. We are ordering vaccine for the 6 month to 4 years and 364-day-old kids. We can put those orders in this week. And we have that same plan to roll out, but we do really want to call out today for any primary care doctors who do vaccines in your offices for kids. This is exactly when we need to step up. Surveys show that most parents prefer to get vaccines for young children in the doctor's office. And so we're going to be working hard. I know Laura Perrojon, Dr. Perrojon is meeting with the New Mexico Family Medicine Association next week. Janice Gonzalez, also a physician. Dr. Gonzalez is meeting with the folks from the Pediatric Society. They're both matching up with their own specialties, so they're considered, sources of reliable information. And as you're getting ready to vaccinate your young folks, don't hesitate to call. I'm hearing that audio might be lost. Jody?
I can hear you, David. This is Alex.
Okay. All right, good.
Yeah.
So just one person has lost audio and she knows what I'm going to say. So that's good. All right. So that push is coming. We'll be giving you more information as time goes on. You'll see those sites online. I will be publishing where everyone can get vaccines for young kids. Next slide, please. The due date for turning in hospital vaccination rates was last Friday. So we're doing pretty well. If you start, let's just start with primary series. 88.4% of hospital employees are mandated to have the vaccine or have exemption. You can see that 88.4, 4.9, 5.9, that adds up to 100%. And so we started with a really good rate, real high rate, 88.4% amongst hospital workers. And of those, 74.8% have received their booster dose. We're still massaging that data to make sure that the percentage there is the percent of people who are due for boosters, not just people who have the primary series. So we're working on that. We had good reporting, only 4 hospitals that didn't report. DOH will be sending out notices to everybody who didn't report, letting them know that they really ought to do that very soon with the penalties for non-reporting. But we know our hospitals are very busy, and so we want to make sure that there's not a communication error or something like that. So we'll keep you posted on that, but good results so far, just like this person in the supply room who appears to be a healthcare worker with 2 thumbs up. So 2 thumbs up to our hospitals who have actually done all this hard work. Next slide, please. Immediately yesterday, I get up really early. I heard on the news that 4 governors had announced the end, a plan to end the mask mandate. And by the time I got to work, my inbox was brimming with emails from people saying 4 other states have ended their mask mandates. New Mexico has to do it today. And so I just wanted to do a little bit of a fact check on this. And, it was New Jersey, Connecticut, Delaware, and Oregon. And none of them actually did end their mask mandate yesterday. They all announced an intention to end their mask mandate sometime between February 28th and March 31st. And if you looked at those statements from governors and others, they said, assuming that trends continue the way they do, and we see this big drop of cases continue, we anticipate we will be able to rescind our indoor mask mandate on those dates shown there. So number one, no one has actually ended the mask mandate. And then the second thing I like to remind people is, while I got a ton of emails yesterday from people and essentially demanding an end to the mask mandate, it turns out none of those are hospital administrators or chief medical officers from a hospital or chief nursing officers from a hospital. In fact, the healthcare industry knows that masks do, even poor masks, reduce transmission of COVID by 50%. We are still in crisis standards of care, as we'll talk about in a minute. And so we don't really make decisions in New Mexico for New Mexicans based on what other people are doing in other states. We use our own data. And you can just see, looking at case rates, New Mexico has nearly 3 times the number of cases per 100,000 than New Jersey does, who made their announcement. We have slightly higher hospitalization rates than most of the states. However, we have lower number of hospital beds, and so that does play in as well. So we will make decisions about the mask mandate. Believe me, nobody wants to end it more than I do, but we have to use the science and we have to use the data we have for New Mexicans and the data we have about masks as well. And so we'll talk a little bit about that data in the next couple slides briefly. I'm not going to read them all, but next slide, please, Brianna. And you know, there's a couple studies out there from California and, you know, in other places, and I'll show you where you can find them all in a minute, but it really does show that participants who wear masks have a much lower risk of contracting COVID. 56% reduction with a cloth mask, 66% reduction with a surgical mask, 83% reduction with a respirator, an N95 or a KN95. Next slide, please. Other studies, I've listed 4 of them here. Not going to read them. I'm getting a call from a representative, so I'm going to just say I'll call later. And lots of studies out there. And then recently, and a lot of you sent me this link to the Atlantic, an article by a couple doctors and a veterinarian about sort of the case against masks in schools. And it talks a lot about how these studies that are referenced on the left side of the slide are imperfect and they weren't randomized or controlled trials. And that's absolutely correct. They were not. And I don't know how many of you out there have submitted research proposals to an institutional review board, but the way it works is you have to show as part of your research design that no human being can potentially be put in harm's way by your study. And so there's no institutional review board. We call them the IRB at University of New Mexico. No institutional review board in the world would allow a study where kids were purposely put in a situation with no masks at all. And so just a reminder that we use the research we have. There aren't randomized controlled trials for a lot of things with COVID. We're using the best evidence we can. And a lot of you send me emails sort of demanding evidence that this works and that works. We don't always have it. I always ask you back to send the evidence of the converse. You don't always have it either. And so we're doing the best we can with the information we have. To that end, on the next slide, you know, you can go to the MAT webpage. If you go to the DOH COVID homepage under medical and scientific reports, click on that, click on medical advisory team. You'll see this on the right, this box on the right of your screen. And that, that gives you a number of options. And the second, third, and fourth here's that are blue, maybe Brianna, you can point those out, actually will take you to links of the summary of the research, not the first one, but the 3 in that second paragraph will take you to a whole bunch of research summaries. Every time we get an article about masks, we review it. There's a PowerPoint presentation with a summary of key reports. You know, 88% of those studies demonstrate effectiveness of masks. Again, it's not 100%, but there's no question that wearing a mask will lower all of our risk of getting COVID. And, you know, if you have a study that says the opposite, please send it. We review them all and evaluate them all, but the preponderance of evidence is very clear that masks work to prevent the spread of disease. And, you know, I think when things cool down in the hospital, we're planning on rescinding the mask order. Next slide. Epidemiology report of the week. I am trying to highlight these epi reports so that you all can sort of become more familiar with them, because a lot of the questions you send in are in the epi reports. And Brianna, are you going to share your screen on this one, or am I?
I can share it, David.
All right, so let me take over here for a minute. Continue here, and just let me know if you're seeing this epidemiology report here.
I see it.
Yes.
Okay, great. And so you get to this again, you go to the DOH website, scientific studies, and then epidemiology reports. We showed you on the previous slide where it's located. And I just wanted to show you a couple of things. You can see the trends in pediatric cases in various age groups. And obviously we've had a huge surge of cases, and more than we've ever seen by a factor of about 3 in 0 to 4-year-olds. And we'll talk a little bit more about them in a minute. 5 to 11, double, a little bit more than double. And then the 12 to 17-year-olds, much more than double the number of cases. I'm not going to stop on every page. I'm hoping not to make you seasick, though, in the process. Here are the case rates by age group. One thing that's worth noting is that a little more than a year ago, 14 months ago, the number one age group in case counts was people 18 and over. Now, in Omicron, the number one age group was 12 to 17. And we're seeing a lot more cases in 5 to 11 and younger kids. So Omicron seems to be affecting a lot more children proportionally than previous variants that we've had showed. Now I'm going to go on to page 6. And here's another interesting slide too. I think if you squint a little, you can clearly see a trend in the blue and red age groups to a higher percent of folks having symptoms. So in kids anyway, over 87% of kids are symptomatic now. They used to lag behind adults, but now they've caught up with Omicron. Next slide. I think I'm just going to show you one more. There's another way to do this. And that is hospitalizations, children's hospitalizations. And, you know, this is an important one as we think about the mask mandate. I get a lot of emails, particularly yesterday, from people that say that no children are being hospitalized or no children are dying. And the death rate is quite small, but I want to point out a couple things. This is the overall adult hospitalizations. We all know Omicron affects adults, but this is 18 plus. It covers a lot more of our population. But look here at the 0 to 4 age group. It's actually shot up to about half the rate, hospitalization rate, chances of being hospitalized, as it has for adults. We've never seen anything quite like this throughout the whole rest of the pandemic. And I guess the most important thing I will say is if you're one of those parents wrestling with, gee, should I get my 2-year-old COVID vaccine? I think this is pretty good evidence that it's a good idea, because we are seeing that increase in hospitalizations in that younger age group. So I'm stopping sharing my report. Brianna, if you can bring the slides back up. That is where it's located on the epidemiology website. I just want to give a shout out to our epidemiologists. It's unbelievable how much data we have. We were talking with someone from CMS today about that, and it's just amazing how hard they work, how you have no idea how complicated it is to program these reports or manually produce them, but they give you an excellent snapshot of what's really going on with COVID in New Mexico. So explore and let us know if you have questions. Next slide, please. Some more questions this week, like what is the exact number of hospitalizations where will be out of crisis standards of care? And the answer is there is not an exact number of hospitalizations. There's a scoring system that our hospitals self-score. We review with them every week. There's a break when we didn't have many cases, you can see there, but since about early October, we've been at the crisis standards of care level. We've stayed there solid. Nothing has changed. We do normally see a lag in hospitalizations going up or down as case curves go up or down. We're right at that point we should see a more significant drop. We haven't seen it yet. I am going to renew the public health order for the crisis standards of care, or perhaps it's an executive order. Either the governor and I will, we have some orders, and so it's hard to keep track of them, but that will be renewed this week to ensure that the hospitals get the help they need. And when people talk about sort of their demands to end the mask mandate, I think that's really that kind of way of thinking completely excludes the experience of our hospitals in the state who've been in crisis basically for 6 months now. And like I said, they're not sending me emails asking to end the mask mandate. They're sending emails saying, please continue it, whatever we do, because we simply can't have more cases. Keep in mind, New Mexico, the Department of Health has brought in an additional 404 healthcare workers to keep our hospitals open and providing service during this crisis period. That's the number that are on the ground today, 404. And two of our largest health systems put together in Albuquerque have brought in over 1,200. So I would estimate that we have 2,000 out-of-state healthcare workers keeping hospitals running, keeping emergency rooms running, keeping general beds and ICU beds open and able to care for patients. And we need to see some softening of this metric you see here, and softening of our reliance on out-of-state resources before I think we're ready to say it's going to be safe to go to another mode of operation. Next slide, please. We showed you our Find a Test newmexico.org website. Please keep going to that. You can see how many tests have been delivered to your counties. We're going to start having a distribution column to keep track of how many have been distributed to people. We're also now able to track federal tests coming in as well. And so in high SVI areas, we don't have federal tests coming into non-high SVI zip codes yet, although they're starting to deliver them. So just as a reminder, right now, today, any New Mexican can get 2 free tests from the federal government. In addition, and I'd say if you have a larger family, you really ought to do this. You can get 2 more tests in your neighborhood delivered to an emergency manager. And finally, we have a partnership with the Rockefeller Foundation and the ACT program. You could also go on and get 2 more boxes. I said 2 more tests. There's 2 per box. So I got 8 here. You can also get 10. You can get 5 tests from the Rockefeller Foundation. So if you have a really big family, please go in and get enough to take care of you. Remember, and look on the back, these do have an expiration date, that use by date. So there's no point in getting a package of 40 in your house to test for COVID. Just get what you need. And we're working to provide continuous, actually mail order to many New Mexicans, all the folks who are customers of HSD. In the next probably 4 to 6 weeks, they'll be able to order by mail order from the state as well. So test at home. If you don't have symptoms, if you're just a contact, you're doing it for work, find a PCR test if you do have symptoms. And although a home test can work too, if you decide I'm having some symptoms, I want to check. If it's positive, you don't need a PCR test. But if it's negative and you're having symptoms, you should go get the PCR to pick up those cases that the rapid antigen test misses. And we're asking people, don't go to the emergency room just to get a test. By now, hopefully most of you have at least 2 boxes of these. Test at home. If you're not seriously ill, talk with your primary care doctor or whoever, but don't go to the emergency except for emergencies. We're swamped right now. That's our pain point within our hospitals, and you can support our hospital workers by getting vaccinated and boosted and wearing a mask, and not going to the emergency room just for testing alone. Next slide, please. I think we're about to wrap this up. Oh, here's one. We showed you this a couple weeks ago, and you can see that we had a really high inventory on hand, over 6,000 treatments in a single week, and that dropped precipitously early in January when New Mexico using scientific evidence, said we're no longer going to be supplying Regeneron or BAM-EDI because they don't work for Omicron. So those are the red and purplish bars there. So you can see big drop in supply, but now it's going back up. And just another reminder, now there are pills that you can take to treat a COVID infection. If you have a risk factor, you only need one risk factor to get molnupiravir. You need 3 points on the system we have to get Paxlovid, but please, if you have any risk factors, seek out oral treatment immediately. We don't have enough supplies to treat everybody with COVID every day, but not everybody needs treatment. And so we're back now that supply is increasing to encouraging all of you to seek out treatment if you do get sick with COVID and have a risk factor. Next slide. And then just finally, get treatment. If you're sick with COVID, you have a positive test and a risk factor, things like being over 64, being obese, being pregnant, certainly get treated immediately, and other underlying conditions we've all heard many times. Help our hospitals by finding tests in your neighborhood to pick up and do at home. There are videos available. You can go online and see how to do it. It's not hard. You don't have to be a doctor to take your own nasal swab. And please, there's overwhelming benefit in Omicron right now to those who have the booster. So if you're part of that group that got your first set of vaccines but didn't get the booster, great time to do that as well. And with that, I think I've highlighted all the key points for this week. Alex, I'm going to turn it back to you and we'll start taking questions.
Thank you, David. Okay, Chris McKee from KRQE has raised his hand, so he'll go first, followed by Julia Goldberg with the Santa Fe Reporter. A kind reminder to folks to please just ask one question so that we have ample time to do for everyone who wants to ask a question to do so. So Chris, go ahead, please.
All right. Thank you very much for taking the time again this week. I know you've had a lot to say about masks, but of course, I've got to ask you another question related to masks. And understandably, obviously, there are the states that have forecasted their end of mask mandates. You do have other states like California, though, and New York, which are pretty soon. I think New York is maybe doing theirs today, if I understand correctly, and California by next week. And I guess I understand basically where you're at with, you'd like to see a drop in the pressure on hospitals, if I'm understanding correctly, before New Mexico lifts a indoor mask mandate. And perhaps this is a little bit maybe more of a forecasting question, but do you see that maybe as March 4th, the current end of the current health order, or is it too early to call? What do you forecast? Is this maybe a March or April thing?
Yeah, it's a great question, Chris, and I appreciate the opportunity to be pinned down even more. I had this conversation with the governor this morning at about 7:30, and we really are relying on New Mexico data. The fact is, we could have made the same statement that some folks made when we instituted the indoor mask mandate. You know, as soon as cases go down, as soon as things get safer, we stand prepared. I think in the press release that we sent out with the most recent renewal of the mask mandate, we tried to be more optimistic. I think I said, I hope this is the last time I have to do this, but the pressure in the hospitals is severe. And I think we're just gonna have to look at the data and see. But believe me, I know Kurt Steinhaus, our Secretary of Public Education Department, I know myself, I know the governor, we all really want to stop the mask mandate, but masks are effective. The state is still in hot water, and we don't really want to do that till we feel that everyone will be safe. So I can't tell you a day, but I can tell you this: as soon as we feel like we're getting to that day, we're going to let everybody know. Just too soon today.
Thank you, David. Thank you, Chris. After Julia, I'm going to turn over to Ryan Botel from the Albuquerque Journal to ask his question, and I apologize in advance if I mispronounce anyone's name. Julia, go ahead, please.
Thanks, Alex. Thank you, Dr. Grace. Thanks for showing that demographic breakdown on the boosters I had requested. I don't think I asked what I was trying to get at very clearly, so I'm going to ask again. I had been reading that one of the hypotheses for the fact that deaths are not declining as much as people would like, it has to do with the demographic spread of booster shots. That is, that there's not enough people people who are more vulnerable to death with COVID are not getting their booster shots. So I think I was trying to look at a breakdown among smaller blocks of ages, and I didn't ask for that. But I guess I'm just kind of curious if you can talk about that, because we talk a lot about the pressure on the hospitals and the case rates and the test positivity rates, but we haven't really talked about if there's sort of I mean, it's a little morbid, but like, is there a target of what kind of fatality rate we'd want to be looking at before we felt like we had turned a corner? And do you think that booster, Alex is going to cut me off because I'm asking 7 questions, but do you think that there's any validity to that notion that more vulnerable age groups are not getting the booster as high rates as they should?
Julia, as always, great questions. I think, our epi team is working really, really hard on the data for boosters. There's a problem with the denominators being slightly different. And so like today, we know that 2.3% of the deaths, which was really only five deaths in the past month, were people who were boosted. 195 deaths, 19 deaths in people who had vaccines but who weren't boosted, and 192 deaths in those who had were not fully vaccinated. They didn't have a primary series. We have not yet parsed that out into subgroups yet, just because of the difficulty of the programming. We run it. I think we have some reliable data for that. That, I believe, may be posted later today, if it isn't already, under the vaccine report on the website. So I think step 1 is dividing people up into the appropriate groups. Recall, we have stickiness with the federally administered vaccines because we don't have those people's names and identification numbers. So we're doing the best we can with the data that we have. But I think that knowing the epidemiologists, they'll start breaking out those demographics more completely in boosted individuals. The data I saw initially was there's a pretty high uptake among older people, which could be a surrogate for sicker people. There's a high uptake among older people of the initial boosters, and booster rates at places like nursing homes, of course, they're required now, have been quite high as well. And so hard to say, though, for the population that live in a place where the vaccine isn't required. But that's a great question, and we'll keep watching that. And I'll let you know if we do get a further breakdown. Thanks.
Okay, we'll turn over to Ryan, and then after that, Anne Perret from KRQE. Ryan, go ahead.
Thank you, Alex. Thanks, Dr. Scrace, for taking our questions. My question is sort of related to masks, but not completely. You talked about how juveniles, kids are going to hospitals in greater numbers than earlier in the pandemic. I was wondering if you could just kind of put that into a little bit of context about it, like how many children are ending up in the hospital, if you think that's because of their vaccination rates compared to other people, and is that kind of something that is also factoring into the state not being ready to announce a decision on masks or masks in schools?
So Ryan, that is a fantastic question, and you just reminded me that there was a really important point I wanted to make about that. And so let me just see if real quickly I can go back to that pediatric report. I can, and show you that graph, and I can do that too, I think. And I think this is the slide where I paused and talked about this spike here. And I apologize that we're doing epidemiological math, but there's approximately 400,000 kids in New Mexico. And I don't have the exact subgroups for different ages. I think there's about 100,000 here. So this means in 15, 14, 16 kids in the hospital during these weeks periods of time in that age group. So it's not an insignificant number of kids. It's not zero. We're kind of used to this, where a bump here is just, one hospitalization. This was 5, as it turns out. But we're watching this. And you might remember as Omicron came through, there were some early reports that, gee, maybe this is affecting kids more. And I think now we know it is. And so I think the other part of your question is that creating a little bit of a pause on our part in the state toward just ending a mask mandate in schools? And the answer is that it absolutely is. I think when the case counts go down, though, as we've seen everywhere, when case counts are high, cases in nursing homes, schools, and others places, prisons go up because those case counts in those facilities are a reflection of case counts in the communities. And so, yes, those numbers are coming down. We'd like to see them back skirting the x-axis there with 0 or 1 hospitalizations. But we're really watching all of these things to make sure that we're going to be okay before we end the mask mandate. And it's possible. I think the discussion I had with the governor today was about adults and kids in school, and are they 2 different groups or not? And we're just going to see how the data plays out in the next couple of weeks. Thanks for that question.
Okay, we'll turn over to Anne, followed by Algernon Damasa with the Las Cruces Sun News. Anne, go ahead.
All right. Hi, Anne Perot with KRQE, new to the team. I saw a lot of talk recently about several states across the country monitoring their sewage systems to help them track COVID-19. It looks like New Mexico did this at one point, but really only at jails is the data that I saw. Can you talk about it all? Like, was it helpful? Did you gain any insight? Is there a reason why it stopped?
Yeah, no, it's a really interesting topic. And we have lots of titles for Jim Kinney, our environment secretary, in relation to testing wastewater. None of them probably that they're not necessarily off color. They're just more adolescent. And I probably should rise above this horrible temptation I'm having to tell you all of them. But Jim and his team, working with our epidemiologists, set up a wastewater sampling system. And we did it in a number of areas. We looked at prisons. We looked at some tribal areas. We looked at a dormitory, I think in Las Cruces. And the thing about it is that what we saw when there was an outbreak of COVID was we saw this immediate rise in COVID in the let's just say the correctional facility. We saw this immediate rise at the beginning of the outbreak. The trouble was, what we were hoping to see was first a rise in wastewater and then a rise in cases, so that we'd have that distance between the wastewater testing and the actual outbreak. And so what we found over the year that he did it, and they did a great job. It's not obviously the best job sampling wastewater for COVID tests, but what we found was that absolutely wastewater indicates the presence of disease in a facility, but not any quicker than routine testing. And so back in the fall, when we talked about it in the middle of the Delta wave, we thought 2 things. One, this could be incredibly valuable for a time in the future when case counts are really low, and we can use it as early detection. So we haven't completely shelved it. We've just put it on hold. And 2, I think we concluded that at least at that point in time, we were more interested in early warning systems rather than just having the wastewater testing tell us exactly what routine testing in nursing homes or prisons or the like we're doing. So I don't think we're done with it. I think it would be a great, if you will, peacetime initiative when case counts are low to do sampling throughout the state. But during times when there's so much testing going on, it didn't really give us additional information. So we decided to put it on hold. But it's interesting. I saw in the paper 3 weeks ago that people testing wastewater in New York City were predicting that the curve was going to go down based on what they were seeing in the wastewater. But then right away, I went to the case count website and the curve was going down. And so it was saying the same thing that the case curve was saying. Thanks.
Thanks, David. Okay, after Algernon, we'll have Steve Edmondson with Socorro Community Radio. He's our final media partner that has a hand raised. So if someone has not yet asked a question but would like to do so, it's an invitation to do that. Algernon, I'll turn it over to you.
Thank you, and hello, Dr. Scrace. We all understand how masks have kind of become this this symbol of resistance to being told what to do and how to live with COVID. Some states take the approach where instead of a mandate, they simply put forward the recommendation based on CDC guidance, and they use a persuasion and education model. And I'm just wondering, as a matter of policy, I mean, do you feel that participation in masking improves by having it as a mandate, or do you think that the state might consider transitioning to a model where we're not going to fine you, but we're going to continue to educate and promote masks?
Yeah, Algernon, thanks for the question. Thanks for sending a similar one in advance. Appreciate it. Gets us thinking. You know, I think I'm always been one. It's kind of like with my kids. Like I've always been one to advise them what to do, but if I think they're going to do something dangerous, then I kind of have to tell them what to do. I don't see the people of New Mexico as kids by any means. I think that we're all adults. And I would agree with you that masks or whatever it is that's mandated ever for anything is a symbol of, rallying cry for people who don't want to be told what to do. So I would be happy to move off that mandate and mandates in general. I think at the beginning of the pandemic, there were 1/3 of people who were ready to do whatever we told them. We do it right away. There were 1/3 who weren't going to do what we said. And then there was 1/3 in the middle that wanted to be educated and moved, But I think that, if you look at vaccination rates, or there's lots of measures, we're kind of in the 80-20 right now. And I would agree that group of people in between is small. It's just that right now, with still having single-digit numbers of ICU beds available for COVID patients, which is awful, that it's hard to do anything that could potentially double the number of cases. But I'm with you. I think my long-term strategy, everything I've talked about with learning to live with COVID, would indicate that it would be a mandate-free sort of society unless we developed another crisis. So I'm with you. It's just we're in a tough spot with our hospital leadership being in the situation they're in, combined with evidence that masks reduce transmission by 50%, even the least effective mask. And so I think we'll get to where what sounds like your vision of the future. It's my vision of the future as well, but we just need some breathing room in our hospital capacity. Thanks.
Okay, David, we're at our final question. And so after that, I'll turn over to you to give some closing comments. So Steve, go ahead, please, with your question.
Okay, of course, Dr. Scrace, you and I have had some email exchanges on this, but Dr. Leanna Wynn, she says it's time to move past mandates to individual choice. She said that yesterday. And she's also said cloth masks are basically face decorations. Dr. Michael Osterholm told a New York Times reporter yesterday, universal mask mandates don't work. And he has said in the past that cloth masks don't work. And that's what I think you would agree. Most people are wearing cloth masks. So where are those people wrong when they say those things? When they say that the cloth masks are basically face decorations, and that to be effective, you're going to almost have to have N95s. And I'm particularly concerned about kids. That my understanding is they don't make N95s for kids. You're not going to put kids out playing sports with N95s on. There's no way they could do that. And I I call basketball games, and I can assure you that kids are not wearing the mask correctly. So is, what is your, how do you just keep having that on there when, as far as I know, there are states all around the country that are playing indoor sports without masks, and they're not having outbreaks, as far as I know. I know in Tennessee they're not.
Okay, so people, let me just address some of the issues you raised. I think they're good issues. We had a major outbreak on a basketball team in New Mexico a year ago. They all thought they had bad allergies, and then the allergies were really bad. 18 women got very, very sick and had COVID. So we have our own data. You can read a list of as many people as you want who say anything they want, really, but we use data. I just showed a slide. I don't know if you're on the first part of the press conference, that cloth masks still reduce your chances of transmitting COVID by 56%. So effective is not 100% in anything. Effective is better than nothing. And I think a 50%, 56% reduction in cloth masks is pretty good and got us pretty far in the first half of the pandemic. I think we all are upgrading. New Mexico's ordered millions of N95 masks. Those will be available. People are sending me pictures of a table full of N95s to pass out at Costco. Pharmacies across the state have masks available there, and the state's going to have its own distribution. So we are upgrading our masks, but we have to rely on evidence, not quotes from people or even expert opinion. And as I said, you might have missed it, 88% of mask studies show moderate to high levels of effectiveness. So we still are going with the data on that. And again, we use New Mexico data. So exactly what other states are doing turns out not to be how we make decisions. We use our own data and where we're at today. Thanks. Alex, we might have a couple more minutes. So is there anybody who wants to ask a second question, or do we want to? I see Julia raised her hand, so.
Yeah. Let's see, we have Julia and Ryan again. So first I'll go over to Julia.
Let's do those two and then we'll end.
Okay.
Thanks, and sorry. Dr. Straits, we had a lot of front-facing metrics since things began. We had the early gating criteria that include the contact tracing during the green to turquoise. We had the test positivity and the case rates and the vax rates. Is there any thought of having some front-facing kind of metrics that are tied to when the mask mandate ends, that sort of people could, as a sort of takeaway, I guess, from all this, do you think?
Yeah, yes and no. I think I showed you the one, which is the crisis standards of care evaluation by hospitals, resources, staff, et cetera, et cetera. That's probably the primary one right now. I think that it won't be cases anymore. It won't be test positivity anymore, because that's kind of become a meaningless number with people testing at home. I think if, my favorite metrics right now for knowing when the trouble is over in New Mexico is when we have open ICU and hospital beds and emergency rooms aren't overcrowded due to COVID. Now, hospitals are full, ICUs are full, and emergency rooms are often full this time of year. But so it's tricky to tease all that out. As in, like, if they were already full and you had one COVID patient, would that be crisis standards of care? No. So I think one of the things we want to do is get together with all of you in the very near future to find out what metrics you're using and do a little bit more automated metric reporting for cases, hospitalizations, deaths every day, maybe cases by county, where you can just go look at that up at 3 o'clock in the afternoon rather than producing this gargantuan press release, and then more data weekly. But we're still working on that. But it's a good question, but I don't think that's going to be the end of it. I think when hospitals open up, it'll be clear, and when they do, and hospitalizations rates are low, and assuming we don't have another, variant that sweeps through next month, God forbid, we're really trying to move us into a new stage. So I think the answer to your question is no, we're not really. I can tell you that all the metrics we used to use really probably aren't as applicable now. And I think we're not looking to do a countywide thing, a county by county thing, just because that we tried that. It was partially successful, but I think we'll keep letting you know what we're thinking though every week. And I think every week we're going to be thinking that we're getting closer and closer. We don't want to torture you or play, what is he thinking or what are they thinking? We'll try to be as informative as we can, but I'm not envisioning dashboard triggers at this point. Thanks. And then we had one more, Ryan, was it? Alex?
Yes, that's right. Go ahead, Ryan.
Hi, Dr. Grace. I'm just wondering, you talked about learning to live with COVID in the past few weeks, and what kind of, have you learned any lessons from Omicron about how, we should sort of keep track of COVID as a state? Are daily case counts as important as they were? Is you talked earlier, I think a couple weeks ago, about focusing on serious COVID rather than just all COVID. What kind of just changes do you envision coming up from the state about how it just kind of releases data and talks about the disease?
Yeah, those are great questions. Just for the record, I've been talking about learning to live with COVID since August 13th press conference, but it's an idea that I guess I was a little ahead of my time, and now we're actually in a point where we could start doing more of it. I think what I said a couple of weeks ago is learning to live with COVID is about more individual responsibility. It's about more tools to deal with the disease, either in our homes or neighborhoods with respect to testing, masks, and pills, really, to treat COVID. I think, there's no reason to suspect that there won't be any more variants. I mean, the virus evolves. It wants to live with us, right? It varies itself so it can continue to live with us. But what I'm hoping is we'll have, if there is another wave, and there probably will be, that we have effective treatments close to home that are easy to get, like a prescription, where we get COVID, we have a positive test at home, we call our doctor, maybe they want to see us, maybe they don't, depending on risk factors and symptoms and the like. And, but we're eligible for treatment and we get that prescription and we take it and we avoid hospitalizations. We can deal with additional waves of 5,000 cases a day if we only had 100 people in the hospital. What's been our problem is having waves of 5,000 cases a day and having 700 to 1,000 people in the hospital. So I think we will focus more on severe disease, hospitalizations, hospital capacity. And I think the rest we really are going to be able to learn to live with. I think there'll always be vulnerable populations. We'll always take greater care with folks in correctional facilities, nursing homes, probably childcare, other congruent sort of settings. We'll always have to do that. That won't change. There will be more vulnerable individuals, but I feel like we're getting there. And I think your feedback really helps us as well. But I think you're right. Case counts, especially, I went on today, there is a website. If you go to the DOH homepage and scroll down just a little bit, and I should show you that as well really quickly, if I can do it. Here it is. Let's just a second. CV. There we go. CV. There we go. All right. So let me share my screen one more time. We do have the ability for people to report cases. I went in today. It's here, positive self-test reporting, and you click in there, and it takes you to a report. And it's kind of interesting. You report your test results, and I'm chicken to do this because I got all the way to the end so I could talk to you about it today. And but you would say, yes, I've had a test, and then it actually, what date did you do it? And you can put in the date. And then basically you go through a contact tracing interview so we can collect data that we collected from everybody who had a test to do it. So I think we'll see more electronic self-reporting, for example. I think we'll see more of this handled in people's homes or over the phone. And I think I really want us to adapt to, one, rebuilding the hospital infrastructure and expanding it, and two, building an infrastructure in our homes and communities to deal with the disease. So not sure yet what we'll be doing, but I think, and then the last thing is giving you all a website you can go to every day to see the data and eventually mine the data the way we do to better understand what's happening with cases, hospitalizations, deaths. And so that's kind of what we're thinking about, but we want to meet with you, get your advice, get your input as to what's most valuable to you. And then hopefully with that input, we'll come up with a plan that you'll like and will meet your needs, and particularly, and most importantly, meet the needs of your readers, viewers, and everyone who listeners. Okay, Alex, I think we're done. We really want to answer your questions. I really want to be available. I'm going to give you some closing comments. Hi from Christine and Laura, who are both working incredibly hard this week on epidemiologic information and vaccination plans. But I think we are about to enter a transition. I think our modeling team believes we will see a fall in cases soon, although this is a hard time to model because Omicron has not behaved like any other of the variants that we've had through. So it's hard to use past experience to predict, but I think there's a general sense we will be on a downhill curve. And as that happens, we look forward to easing things up. To Algernon's point, I look forward, and believe me, the governor and everyone is just as eager as we could be to not have mandates, but we want to protect kids, the vulnerable, and our hospitals right now. But as soon as we get out of this, I think you'll see a lot more of more change coming down the road, as well as our data that we have on New Mexicans and not people in other states tells us the time is right. So with that, wear your mask, wear a better mask, as Steve Edmonton pointed out. Make sure you have these tests at home and tell your listeners, readers, viewers that they can get more from ACT and that they can actually get more from state drop-off sites. And let's have everybody ready to manage this disease at home. The governor and I did meet today with a representative from Health and Human Services, really made a strong case for the fact that being one of the most vulnerable states in the country, we're either 1, 2, or 3 every year when the CDC publishes its social vulnerability index, we're about 62% higher than the US average. We said, we want 62% more of everything. And if you can get it to us, we can get it out to every corner of the state. So at least they said our arguments are persuasive. I think we're going to continue to push for more tests, more masks, and particularly more oral treatments as the manufacturer catches up with unprecedented demand. And I am feeling optimistic. I will say that things are coming down pretty rapidly. So thank you all for your attention. Look forward to seeing you in the near future, either next week or the week after. And of course, we take questions between these press briefings. Just send them into Jody or Katie over at DOH. Thank you very much and have a pleasant day.